Welcome to the Gentle Childbirth Foundation film, Vaginal Birth After Caesarean, or VBAC. If you've had a caesarean section in the past and are wondering if a vaginal birth could be right for you next time, then this is the film for you. It may also be of interest to midwives, obstetricians and anaesthetists. In fact, anyone involved in childbirth. We're going to talk to one mother who managed a natural birth the second time around, having had a caesarean the first time. We will also hear from a leading obstetrician and an experienced anaesthetist about the risks and benefits of a vaginal birth after caesarean. Finally, two mothers have allowed us to follow them through their second pregnancies as they try for a natural birth after caesarean. All three mothers have a story to tell, and hopefully their experiences will help and inform you whether you're a mother or a health professional. Let's start with Basia, mother of two.
So with my first daughter, Maya, I was planning a natural birth, but 2 weeks before her due date, I found out that she was breached. I tried to have an ECV where they tried to turn the baby around, but that wasn't successful. So in the end, I had to have what they call a natural planned caesarean. They'd let me put music on in the background. My husband was obviously there with me, and I got to see the baby come out almost, and hold the baby and have skin-to-skin contact, which was great. But obviously it wasn't the natural birth that I'd planned. I was connected up to a catheter, and I had a drip connected in my arm, so I wasn't as mobile as I would have liked to have been. It was quite hard for me to lift Maya, my daughter, out of the cot and sort of breastfeed her. And in the end, they convinced me to give her formula that night. I think it would have not have happened had I not had the caesarean. So I was in hospital for a couple of nights after the caesarean, and when I got home, the impacts were that I wasn't as mobile as I would have liked. I had to rely on my family quite a lot to pass me the baby for feeds and to help me with bathing and changing the baby and stuff like that. Also, annoyingly, I had to do injections every day in your stomach. You have to do these injections to help the healing process, I think. So that was quite annoying and painful. Then also you're not allowed to drive for 6 weeks, which was a major thing for me. So I assumed after the first birth that I would have to have another caesarean for the next birth. I did actually ask the midwives, and thankfully they did say that I would be able to have a natural birth. So I was quite pleased about that.
In common with some mothers, Basia wasn't aware that vaginal birth after caesarean, or VBAC, was a real option for her. But after looking into it, she decided to try for a natural birth the second time round.
My second pregnancy, I had a great pregnancy again all the way throughout. The baby was the right way round, thankfully, all the way through. But then my due date came and went, and I went over the due date. And slowly they started worrying that the baby was going to be too late. So I spent all weekend bouncing around on my ball and trying to get the baby to come down and position itself in the right position. And then literally on the last possible day, the 9th day, I went in for a sweep, and luckily they could do a sweep, and literally my contractions started straight after. So I was really, really happy. So with Aniela's birth, probably a more special experience, I'd say. The whole thing was more intimate. It wasn't such a cold surgical environment. There was only literally me, my husband and the midwife, which was really special. And, the feeling of, yes, I've done it was really overpowering, really. It was great. So after I came home with Aniela from the hospital, I was obviously tired, but I definitely recovered a lot quicker than I did last time. Dealing with a toddler as well at the same time, it had its major benefits, because I couldn't imagine being immobile, having a 2-year-old and the baby to deal with at the same time. Well, immediately after, she definitely latched on easier than Maya did. And she's generally been an easier baby. She hasn't had any colic or reflux or anything. But I can't say that it's because of that, but I'd like to think it's because of the natural birth. But yeah, she's definitely, a healthy baby, as you can see. If I were to have a third baby, then yeah, definitely it opens up options of having another VBAC, basically, in which I would very much like to do again if I could. And they always say the second time round it's a lot shorter, so I'm sure it'd be a lot easier this time as well.
The thinking on vaginal birth after caesarean has changed over the years, not least because of surgical advances.
Yes, it used to be thought that if you'd had one caesarean section, then you always should have caesarean sections afterwards. And the main concern was the risk of the scar rupturing. So when caesarean section was first introduced, if you like, which was over 100 years ago now, it was usually done through an incision that went sort of up and down on the womb. And this doesn't heal so well, and there's a risk that if you then go into labour with the next baby, this can rupture. A modern caesarean section, a so-called lower segment caesarean section, which is done with an incision that goes that way and low down on the womb, that heals very well indeed. So the risk of the scar rupturing if you go into labour afterwards is very, very small indeed. So in the last 10 or 20 years it's become realised it's actually quite safe to try to deliver vaginally after you've had a previous caesarean section, and so we've changed our practice really.
This is Mandy, the first of our mothers-to-be. Her story starts in the early stages of labour with Louis, her first child.
I was basically in labour for 5 days, but it was early labour. It was what they call sort of first stage labour, in that I was just taking a long time to dilate, partly due, we didn't know, but it was to do with his position. I think it was day 4. I ended up in labour ward and wonderful midwives, and I was on antibiotics, and then I was monitored. And then they suggested that I take syntocinon and an epidural to speed up the process of dilation. And it worked. As I dilated to 10, and the plan was that once I was dilated, the epidural would wear down and I'd be able to push him out. Anyway, it'd been so long, and I think Louis, my baby, was so tired that he began to go into distress. So there was meconium showing, and his heart rate was beginning to weaken. And very, very quickly it went from, yes, we're almost ready to push out, and to, can you sign this paper, and into theatre. We tried in theatre with forceps, we tried with ventouse, I tried pushing, we all tried, everyone, the whole team, myself, the baby, we all tried really hard to come out naturally, but they ended up having to give me a C-section, which was, again, at the time, the best option. And I was really thankful for it, actually, really thankful for it. And it was the most incredible moment of my life when he was presented to me over the little bit of sheet.
Mandy had her hands full with a healthy baby boy, but before long she had to start thinking about another birth.
Well, I found out I was pregnant again when my son was 8 months old, and I was completely in shock. I was still breastfeeding my son, he's still a tiny baby, and all of a sudden I'm starting to have to think about birth again. And having had a caesarean first time round, it was rather daunting, and I had no idea what was available to me. I knew that I'd rather not repeat a caesarean, if possible, but I didn't know what my options would be. I had no idea that I even had options. So I started looking into birth after a caesarean. Started asking people, friends of mine who are birthing partners and things. And the word VBAC emerged, which means vaginal birth after caesarean. And it was like a light bulb went off. It was like there's an acronym for what it is that I'm wanting to do. So I started looking into it online, and all of a sudden there's all this information on VBAC, and there were from mothers' stories to midwives' tales to journals from the Royal Society, Royal Colleges of Obstetrics and Gynecology, and also information that my birthing partners were able to tell me about. So it's all out there.
You may have had a caesarean in the past for a number of reasons. Perhaps an emergency due to the baby's abnormal heart rate, or your baby was breech. In some cases, the reasons for the caesarean and how it went may well have a bearing on your ability to deliver naturally the second time around. But your obstetrician will talk this through with you. As with any birth, knowing your options and what to expect is all important.
There are some women who, having had one caesarean section, would actually prefer to do that again. And in my view, that's absolutely fine. But there are some women who would like to deliver normally, but had to have a caesarean section the first time round, for a medical reason, a breech presentation, for example. So one factor to take into consideration is what the reason for the caesarean section was the first time round. Although in fact, most people, whatever the reason for the caesarean section the first time round, will succeed in delivering vaginally the second time round. It's only if, for example, the mother has a very, very contracted pelvis or something like that, that you're very unlikely to succeed.
I'm 36 weeks. So far, so good. It seems to sort of have its head down most of the time. It's been a little bit transverse. It was transverse in my last antenatal check, but then it moves all the time, and I'm feeling that its head is down most of the time because I can feel it now. In my birth plan, I'm not going to say no to anything this time round, but I would say what I would prefer, what I would rather, and where my emphasis will be in terms of I'd rather not have to take pethidine, I'd rather not have to have Vaginal, I'd rather not have to have an epidural. However, if necessary and according to the expertise of the people around me and myself, that feels the right thing to do, then obviously that's what we have to do because the priority is always the health of the baby.
People used to say that if you were going for a VBAC birth, you absolutely had to have an epidural. In some cases, women who are going for VBAC birth will be at increased particular risk of ending up needing a caesarean. Not just because they're VBAC though. So if they've got added risk factors, I would say in that kind of case, I would go and discuss the advantages of having an epidural. And in that case, the advantage is that the epidural's there in place should she need emergency intervention, and you can just top it up. I wouldn't say there's a blanket rule that every woman should have an epidural in this situation.
There isn't any particular need to overly medicalise VBAC. We do need to monitor the baby, but we can do that using a monitor which has a little radio transmitter in it so that the mother doesn't need to be wired up to equipment. The radio transmitter is waterproof, so it's possible for the mother to have sit in a pool, for example, for pain relief. There's no particular need to have bright lights on in the room. That doesn't help us in any way to, diagnose scar rupture or whatever, so you can have low lighting. So those types of things help to improve the outcome.
The most important thing is the relationship that develops between the midwife and the mother. And then things like using different positions, using different equipment like the birthing ball or a birthing stool, being able to change the environment, turn the lights down, for example. All these are really important.
The same factors that would promote a successful vaginal birth in somebody having their first baby, or indeed their subsequent babies, would also help somebody having a VBAC. So things like being able to deliver in a comfortable environment, having the people around her that make her feel comfortable, not feeling particularly medicalised, these types of things that reduce anxiety, that produce a calming effect. These are the things which I think improve the chance of succeeding with a vaginal birth after caesarean section.
I'm a woman and women have been given birth for years, and I'm sure that, that I've got the backup of technology and science. So if anything is beginning to go wrong or there are any signs of anything, the science is there to pick up on that. I've been very fortunate in that I've had continuous support from the VBAC clinic that I attend as part of my antenatal care at the hospital I go to. And so I've been able to see other women who have chosen this path as well regularly, and we're able to discuss openly, our fears and our hopes, and that has been really, really helpful. It's a sort of, it feels like a little enclave of women who are really, clear and decided that this is something they really want to try and do, and that sort of antenatal support has been so beneficial, so beneficial.
Let's pick up Mandy's story at the hospital, where she's well into her second labour and hopefully on the way to a first vaginal birth.
When we got to hospital and Jenny actually said to us that yes, we were going to be delivering that night, my husband then called my friend and she came to hospital and was there within half an hour. It was really very, very helpful having her there actually. It allowed Jenny, my midwife, to really focus on my glucose levels, heart rate and all of that. And having my friend with me really helped support me in another way, which was physically making sure I was very comfortable. She was massaging me, she was very hands-on, and it just gave me a very sort of feminine aspect. And my husband was there to sort of help Jenny if she needed anything and make sure that I had what I needed. Every time I went into a contraction, I tried to remind myself that my body was opening and what I was experiencing was pressure and warmth, not pain. And I kept telling myself that through each contraction, and that is really what helped me. That really gentle massage, my friend was massaging my back, which helped me take the focus from my brain down into my body. Gas and air helped because that helped me steady my breathing. Because there's a tendency when you're in pain to go up here, and actually keeping the breath lower in the body helped me breathe out, and it actually helped the contractions go quicker. I had gone through all my contractions. I got to a point where I felt the most almighty urge to push, and I was told to hold back because there was something not quite right. Its heart rate was beginning to dip, and Jenny became very concerned about that. And I just thought, but I'm ready to push. I can push it out. What do you mean there's a problem? No, not now. I'm ready. Surely we're almost there. So the low point was when I had to basically go from this position that I'd been in with my pillow onto the table, and all of a sudden the medical crew came in, and I was really disappointed. But obviously, if there's an issue and there's a problem, then that's what the medical team are there for. And in they came, and actually it was all very quiet, and it didn't break the atmosphere too much. The doctor who had a ventouse, she said to me, if you don't push him out in 2 contractions or so, we're going to take you to theatre. And I, almighty strength, like a lion, roared him out, and out he came. He came out with some help and was put on my breast, started feeding immediately. And whilst he was feeding and we were sort of just meeting one another, I had some stitches. And then they had to take him to test and make sure that he had 10 fingers and 10 toes and all of that sort of thing. And I lay on my side for a while, sort of recovering, because I felt like my bottom was dropping out of me. Felt what I was feeling, which was quite uncomfortable down below, but at least I could feel what was happening. And then Jenny started running a bath, and then turned the lights down low and gave me back my baby and said, would I like to have a bath, which was just the most brilliant idea. So then we went and sat in this bath, which was fantastic because I felt like I was being cleaned and my baby was being cleaned, and we had our first little dip together. I found myself very, very quickly after giving birth feeling quite playful and emotional and able to engage with my baby, whereas first time round, my first experience of being in the water was when I got home. My mum had to bathe me, let alone me go into a bath with my baby. I had to be bathed by my mum because I needed help getting in the bath because I had a major abdominal surgery. So it's a completely different start to life and a different start to being a mum.
Mandy's story shows that even if things don't go absolutely to plan, it is still possible to have a vaginal birth, and she, for one, is in no doubt that it was worth trying. As well as a much quicker recovery, there is another reason for considering vaginal birth after your first caesarean.
If we were thinking about the first baby, actually delivery by caesarean section or vaginal birth are about equally safe for the mother. And in fact, delivery by caesarean section is possibly a little safer for the baby. The trouble with caesarean section is that each subsequent caesarean section then becomes more risky, both for mum and for the baby. Whereas when you've delivered one baby normally, subsequent babies will be more easily delivered normally and it gets safer and safer. So I think one thing to take into account is how many babies the mother intends to have. If she's had her first baby by caesarean section, but she plans quite a large family, it would be a much better idea to try to have the subsequent babies normally.
Let's meet our second mother-to-be, Laurel. Her story starts when she is pregnant with her first child.
So the pregnancy went really well, and coming up to, at about 38 weeks, I felt like I was ready to give birth. I felt ripe, I guess, and everyone around me was saying, "You seem so ready, you're really in the zone." And then, funnily enough, I went overdue. At 42 weeks, they said, "No, we really do need to induce you." When they were in the process of the induction, so they hadn't given me the drugs yet, but it was all sort of being lined up, they said to me, "What pain relief would you like?" And I said, "None. I want to try and do this as naturally as I can." And I think in my mind I was thinking, okay, well, they're going to give me drugs to bring on contractions, but then I'm going to manage this as naturally as I possibly can. But as far as they were concerned, I think at that point I was in a medical situation. And my experience is that natural and any concept of natural just went out the window. So they gave me the prostaglandins, and it was quite an alarming experience actually, because I went from no contractions to having a very strong, what felt like to me a very strong contraction every 10 minutes. When they said they wanted to give me the next round of drugs, I knew at that point that if they gave those to me, I wasn't going to be able to manage the contractions without pain relief. And I really didn't want to go that whole epidural route, particularly as it had only been 2 hours or something that I'd been labouring, and I thought, well, I'm in labour, this is happening, I've got strong contractions, I just want to be left alone. But when they fully understood that I didn't want to have the next round of drugs, they said, "Well, I'm sorry, we're going to need to move you out of this room." And they put me onto a ward with lots of other women, and it was quite late at night by now, and all the other women were really trying to rest. They weren't in the same position as I was in. They weren't in full labour. And there was me groaning with all these poor women around me, and suddenly I felt responsible for them too. So between each heaving contraction, I was saying, "Sorry, I'm really sorry, everyone." And I think essentially the birth experience, like I said, is one where you need to go inwards and give all your energy to what's happening. And that's what the body's asking for. It's saying, give me all your awareness. And what was happening was that I was constantly being brought outwards. Lights and just random people walking in and out of the space, which was tiny because I was in suddenly a little ward with curtains, so I had nowhere to move. It was the exact opposite of everything I had wanted, and it was about 18 to 20 hours. And finally, I knew that I was going to pass out actually if I didn't have pain relief. It got to that point where every contraction I thought I was getting kind of these black and white shuddery, it was quite nightmarish. So the epidural was a huge relief, and I was able to sleep for about 8 hours on the epidural. In that time they gave me the next round of drugs, and I didn't progress at all. So I hadn't dilated more than 3 centimetres at all, and after the 8 hours and with the second round of drugs I still hadn't dilated at all. So at that point they felt that Heath was tired and not managing so well anymore, and his heart rate was beginning to falter a bit. It wasn't remaining steady, and so then I had the C-section. So thankfully he was rooting from the moment we made contact, and he was sucking on my nose while they were stitching me up, and I was wearing a gown, so I couldn't actually feed him, and I was I can't remember, I think I was lying down. It was all a bit awkward, but as soon as I got into recovery, he was able to feed. The surgery is full on. I also remember recovering for those 4 or 5 days that I was in the hospital after the surgery. And there are midwives around, of course, to help you, but I needed to get up and use the loo and get up in the middle of the night and change Heath. And all of that was quite demanding after major surgery, and not just major surgery, but quite a major just ordeal, a long ordeal. So it was less than ideal.
What's doing?
That's your hair. The doctor, once I'd had Heath, he did come to me and say, there's no reason why you can't have a VBAC. But that was on the back of him saying, well, you got a healthy child at the end of it, so that's all that matters. And that is the most important thing, it is. But the problem about that, I think, is that everything else can sort of get swept away in the knowledge that as long as there's a healthy child, how that child comes into the world doesn't really matter. Whereas, of course, to me, it really does matter.
Laurel talked to us about her hopes for her upcoming VBAC.
Yeah, I have 6 weeks to go now, so... But I feel well and healthy and hopefully strong enough to manage a natural labour, and looking forward to it. In my ideal world, I'll go into labour nice and smoothly, and maybe it will be night time and I can sleep through some of the preliminary stages of it. And then as things get stronger, I can go to the hospital and go to that lovely birthing room and just let it progress. I'm not planning on having any pain relief. If I can be in the water, that will be enough. And if I can't be in the water, then just being able to move my body and breathe and use some of that equipment, the ball and the mat, and just to be able to be active, to be able to move around rather than being attached to a machine. The last thing I want is a caesarean. And I'm aware that the last thing I want might happen. I know that if I do have to have a caesarean, I'm going to have the most sensitive caesarean that I can have, and that makes me feel better. But as long as I'm not late, and that's what I'm praying for, is that I'm not late and that I go into birth naturally, I should be okay.
So one of the most important factors is going into spontaneous labour. You have a much better chance of succeeding if you go into spontaneous labour than if you have an induced labour. And most obstetricians wouldn't be too keen to induce labour anyway in the context of a VBAC. So if the mother goes overdue, for example, you might want to do a few sweeps to try to help spontaneous labour to occur.
As it turned out, Laurel's due date came and went, but she was still determined to try for a VBAC. Let's pick up Laurel's story as she goes into hospital in the hope of delivering her baby as naturally as she can.
So after 10 days being overdue, we decided that I needed to go in so that I could have some possibility of having a VBAC. First they broke my waters to see if that would help.
Breaking Laurel's waters did not bring on the contractions she had hoped for. Inducing labour in the case of a VBAC has to be done with great care. However, Laurel was keen to deliver naturally, if at all possible, and that meant inducing her.
They gave me a syntocinon drip, and the contractions very gradually came on.
Syntocinon, a drug to initiate contractions, is given by a drip, controlled by a pump. This enables us to control the drug and its effects, even stopping it altogether if there is a risk to the mother or baby.
She was checking my blood pressure, she was making sure that I was okay, as well as monitoring the baby.
We used syntocinon with the supervision of the obstetrician and continuously monitored Laurel and her baby.
Because of the telemetry, which is the wireless monitoring, it meant that I was able to sit on the ball or hold it and rock on it. It was so nice to be able to move freely on the mattress, and I was able to hold on to the side of the bath and use that as a support for my contractions as well. At the beginning, I didn't need pain relief, and then they got horrendously painful, and then I had gas. We were monitoring Lois's heart rate and her heart rate was beginning to become unsteady. And Jenny was taking the dose of syntocinolone down until I was on the most tiny dose, and I wasn't really getting strong contractions. And we could have gone on like that, but I wasn't progressing. My cervix wasn't dilating. So I had to come off the syntocinolone entirely for a while until her heart rate steadied and evened out again. And then at that point, a surgeon came in and assessed me, and he suggested we try again. So I went back on the syntocinolone, very gradually building it back up, but very quickly the pain kicked in, and it felt like I was just too drugged up with the induction drug. And at that point, it was really clear that a C-section had to happen.
There are probably 2 or 3 circumstances which would lead to a need for caesarean section during the VBAC. The first is if the progress of labour isn't going well. If labour is clearly going very slowly, if it seems that the baby is getting stuck, and that therefore increases the risk of scar rupture. If that happens, there isn't a great deal of urgency to do a caesarean section, and therefore you can move from the room that you're conducting the VBAC into the operating theatre, and you could conduct a family-centred caesarean section to give the mother the best birth experience that she could have. It's possible that caesarean section might have to take place because we're concerned about the well-being of the baby, and that would mean that we might need to do a more rapid caesarean section. Under those circumstances, it does become more of a medical issue, and then we need to do things quickly, and to a certain extent, some of the things that we'd like to do to make the caesarean section as happy and as nice as possible fall by the wayside. It would be very rare for us to need to do a very rapid emergency caesarean section. That might happen if we thought there was a risk that the scar was rupturing, or if we thought there was an immediate risk to the life or well-being of the mother or the baby. But vaginal birth after caesarean is conducted, in a labour ward where we are able to do those sorts of things very, very quickly indeed. So we can turn, if you like, what was originally a fairly non-medicalised childbirth very quickly into an emergency situation and deal with that.
By the time the decision to have a C-section was made, I was in severe pain, and it took a while to get set up with the epidural and to actually get into theatre. But the team worked as quickly as possible to get that organised, and they wheeled me into theatre, and within 40 minutes Lois was out.
Although Laurel had set her heart on a VBAC, she knew births don't always run to plan, and she was well prepared.
About 10 days before my actual due date, we had an actual rehearsal in the room and went through everything together. The possibility of being induced, which is what happened in the end, and if I went to caesarean section, which is what happened in the end. But also we talked about if I went into labour naturally, how I might use the pool with the monitors, what positions I could be in the room. We talked about so many things. It was so special that really, really helped me and Dom and my birth partner feel confident on the day. I had been in so much pain that it was a huge relief to be completely numb from my chest down. So I was aware of a lot of tugging and pulling, and this was nothing new to me. I've had a C-section before, obviously. But when they said, I think they said something like, okay, we're almost there. And very shortly after that, I could see Lois being handed to Jenny, and I think Jenny just checked her very briefly, told me that she was a girl, and then they handed her to me, and I was able to put her straight onto my chest, which was amazing. I think I told her that I loved her. So lovely to meet her. It was absolutely worth trying to go for a VBAC, because even though I ended up having a C-section, I did get to have some experience of what it might be to have a natural labour.
3 mothers, all had a caesarean first time round, and all of them wanted to deliver their second child vaginally. For Basia, a sweep on the 9th day after her due date resulted in a natural labour with no complications. Both she and her baby are doing well. For Mandy, a spontaneous labour but a bumpy ride. Concern for her baby's heart rate resulted in a ventouse delivery, but in the end she managed the VBAC that she had wanted and was happy to be at home the next day with her family. For Laurel, her determination to make her second labour as natural as possible was hampered by the need to be induced. With careful planning and teamwork, she was able to have a more natural, family-centred caesarean and is happy she made the right decision. Vaginal birth after caesarean is not always possible, but I hope this film shows it's a very real option.
Go for a VBAC if you can, because it was really worth it for me, and I'm really, really glad I did it. And yeah.
Yes, yes, it was so worth it. It was so worth it. In every way.
If I were to get pregnant again, I would absolutely try for another VBAC. I wouldn't go the induction route. If I went overdue like I did the last 2 pregnancies, I think I would have an elective C-section. But if I went into labour naturally before my due date, then I would definitely go for a VBAC.